Well, good evening, Dr. Miller here. And Jessica was supposed to be back, but she's not back yet. Her sister's birthday is today, and she's delivering gifts. So, today, what we're going to talk about is we're going to talk about functional medicine and why it works. Basically, why, within almost or virtually every condition, this helps, if not cures the problem. And I say cures loosely because if you go back to your old habits, typically the problems that you had that you got rid of, they come back. So, just a moment to tell you about myself and Jessica, who's not here. My name is Dr. Trevor Miller. I am the treating physician at Integrated Health of Indiana. And Jessica is my wife. She is also a registered nurse. She has 13 years on the floor and she has done about every position that a nurse can. I've been a chiropractor since 1995 and I have been in functional medicine and nutrition since my children were born in 95, 90, well, 96. Aiden was actually born in 96. And so I've always had an interest in functional medicine. Zoe and Eliana were actually born with mitochondrial disease, and they were not given much of a chance to live. Actually, they weren't supposed to live past the age of 13. And through functional medicine and nutrition, and a lot of watching of them by their mother and me, they have done quite well and outlived their condition by, well, Zoe is, let's see, 20, Zoe is 25 now, and Eliana is 21. And so they have done quite well. And so, why does functional medicine work? And so, the first thing you have to start to change your thinking about is that functional medicine is not medicine in that we're giving you a medication, a pharmaceutical, or something like that. You have to really start to realize how the body works. And the body is not just, oh, I have a headache and this is the problem. And we have an adage in functional medicine that is called one symptom, many causes. So basically, you can have one symptom, a headache, but the causes could be a multitude of causes. Is your insulin high? Do you have inflammation of some sort? Is your blood sugar high or low? Are you deficient in micronutrients? Why? What was the cause of the headache? And a lot of people really can't wrap their head around that. And the flip side of that is you can have one cause and a plethora of symptoms. And that kind of boils back to your genetic makeup. How are you designed to actually express your genes? And then what has been allowed to happen? So that is something that really, really, really got to wrap your head around. And let's just talk about what happens if one of the most common things we see is high insulin. So if your insulin is high, and that's the cause, so insulin is high, and then the cause of that could be because you eat carbohydrates or you have damaged the pancreas in a way. But whatever the case, insulin is high, and now you have insulin resistance, you're gaining weight. You have headaches, you get migraines, you have an autoimmune disease, you have inflammation. High insulin can also express itself as joint pain, most commonly, usually shoulder pain. And so when you have one cause that hits all of these symptoms, looking just at symptoms is only one piece of the puzzle. And we don't want to go in and just cover up the symptoms, because if we cover up the symptoms, then you allow this problem to smolder. It's kind of like the analogy is you're in your car and the check engine light comes on, but everything is working well. Nothing seems to be the problem. The car's running, you don't have an issue. And so when all of this is happening, all of a sudden, what do? Well, I'm just going to put a piece of tape on that light so I don't see it. Well, what does that do to you? Well, think about this. If you don't see it, then it's out of mind. So if you don't have the headache, but you don't get to the underlying root cause, what is happening? Then all of a sudden that is allowed to smolder and go on for years and years. And this is when we say, you really want to start to do testing and figure out what has the potential to go wrong in your body, so that at that point in time you can get ahead of it. And that's no different than with your health. And so when we look at this and we're talking about, the root cause and all the different symptoms, there's, I don't want to oversimplify this, but there's really generally several things that can be an issue. We call them the pillars. One is sleep. And if you've watched any of my videos, you've heard me talk about these things. But basically, they're the habits and the lifestyle that you do. So, sleep, nutrition, exercise, stress, and community. And I know that sounds really simple, but for people, one of the things that we see is one of the most common things, and we are a food first program. People don't know what's good and what's bad. We have grown up with, we've grown up in an environment where sugar is everywhere and simple carbs are everywhere. And we've been told by decades, for decades, by the authorities, by television, hey, it doesn't matter what you put in your mouth. You can eat whatever you want. And if something starts to happen, we've got a pill for you. But once again, we get back to the problem at hand. When you sit there and you cover up those symptoms with metformin, um, if you're really not getting to the basis of why you have insulin resistance, and people that are on tirzepatide or I don't want to say omeprazole, Ozempic, when people are on these things, don't get me wrong, they do help. They help resensitize the cells to insulin. But if you don't go that step further and start to change what you're eating, what happens when people come off of these things? All the weight comes back. The insulin resistance develops again over time. And so it's not that they're bad. We actually have people that we help in tandem with the pharmaceuticals. So food is absolutely something you've got to get a handle on. And I'm not going to say that we don't eat out. We do. We're very careful with that. And so as we do all of that and we look into this, we know that food causes a breakdown. Certain foods cause a breakdown in the gut. Certain foods cause inflammation. Certain foods cause the gut to break down over time and then start to cause allergies, or it starts to cause skin conditions, or it starts to cause joint pain. And that just rolls down the line and continues to get worse and worse and worse. And what people don't realize about food is the problems that I talk about with food aren't like a food allergy. Oh, I ate peanuts. I'm allergic to peanuts. And so I need an EpiPen. It's not an EpiPen type of reaction. This is called an IgG reaction. And this can happen up to 3 days after you've eaten the food. And human beings have a tendency to have cause and effect be very, very soon. When they're very close to each other, cause and effect, we're really good at teasing that out. But when the cause happens and it was 3 days ago, what did you eat 3 days ago? And people don't know. And so they have to start to figure this stuff out because it absolutely affects your health. The next thing that I want to talk about, and it kind of goes along with food, is gluten sensitivities. I actually have the genetics, the HLA-DQ2 genetics, that leave me susceptible to gluten sensitivity, non-celiac gluten sensitivities. And so people that don't realize or don't know that they're sensitive to gluten can eat gluten and it doesn't seem to have any issues or any effects on them, but it's causing a skin rash. It's causing leaky gut. It makes the allergies worse. It makes them itch. There are 1,001 things that gluten does to people, but you got to be aware. And one of the ways that you can start to tell if you have a sensitivity to gluten is look at your tongue. And if you look at my tongue, you see this little crevice in the center. If you see a crevice in the center of your tongue, chances are you have a SNP in the HLA-DQ2 or DQ8 genes that cause you to be gluten sensitive. That is a sign of gluten sensitivities. I know that I am gluten sensitive when if if I hadn't done the things that I have done in the past to heal my gut, to fix my gut, to keep my gut conditioned, anytime that I eat gluten, I would have a reaction. But I don't have those things anymore because of how I do that. There's actually a question on here. Can you please explain what gluten is and how to knead it out properly? I don't know how to knead it out, but what gluten is if you look at the kernel of wheat, and you can actually go online and they'll show you. You can cross section that kernel of wheat, and the white stuff in there is gluten. And what has happened is what we have done to gluten over a long period of time. We have taken wheat and we've made it, I think it was in the 1950s. I don't quite remember the timeline, but we have hybridized the dwarf wheat strain. And it went from about 3% gluten to about 50% gluten. Yeah, that's probably an exaggeration. Let's say 30% gluten. I forget what the exact numbers are. But we have multiplied the amount of that's in there because we actually like that. And so what gluten does is it's just kind of like the name says, it's glue, it sticks, it holds things together. You can take enzymes. The DP4 enzyme helps people who are sensitive to gluten break it down better. I don't know that you can knead it out. The only way I know to get gluten better is to actually order original wheat strains from overseas, from Europe. I think won't work for me. Well, I guess I would have to say, when you look at gluten, I know there has been a hybridization of gluten in the wheat strain, and it has been made more, in the order of 10 times more. And as we see how that has happened, we have seen that autoimmune diseases have also gone up. You can go look at that. No, making pasta and homemade, making pasta and homemade does not need the gluten out. If you use American wheat, like I said, if you use a strain of wheat from Europe, that has less gluten in it. That's why people can go overseas and eat the bread in France and can eat the pasta in France and they don't have a reaction to it. The American wheat actually has several things wrong with it, and I'll just name off two. One is the amount of gluten in it is increased a bunch. The next thing that happens is glyphosate residue cannot be properly removed from the wheat kernel. And when we condition the ground for wheat to grow wheat, we spray glyphosate on it. Most people do. Most people that monocrop spray glyphosate on it. And after you put the glyphosate on it, it grows. And then for ease of harvesting, they spray it again. And then it's there. Well, I would have to say that to your comment about the wheat, that's right. And American wheat is not good. So once again, you need to, if you're going to do that, if you're not gluten sensitive, then you have to get your wheat from overseas. If you're getting your wheat from overseas, I don't have any issues when we order wheat from overseas, nor does my wife, and we both have the genetics. Kneading it, folding it, pounding it, doesn't do anything to the gluten. The gluten does not disappear from the wheat during the kneading process. The gluten still remains. So, but I do agree. If you're using wheat from America, it is not a high quality wheat. If you look at actually the wheat that pizza places get, it will actually say on the bag, high gluten wheat. Yes, I have. I have made tons of different breads and everything else. And the only thing that I have ever seen that makes a difference in the bread for us is either when we're overseas and we're traveling and we eat their stuff, or when we import the wheat in, or when we go to a restaurant that uses that wheat. So yes, and maybe for you, it has had different things and it doesn't hurt you. But the only way you can actually do that is if you check what is called a zonulin in your blood. And if you check zonulin in the blood or stool, either way, it can happen. If you see zonulin in there, then you have had an acute exposure to gluten, and depending on the reaction is depending on how sensitive you are, if you are sensitive to it. I am very sensitive. And when that happens to me, then once again, I'll break out in a rash or I'll itch, whatever the case may be. And it doesn't have to be from bread, it could be from beer, it can be from. It could be from any pastas, breads, and the funny thing is you can actually be getting a gluten-free bread wheat, but it doesn't necessarily have to be gluten free. They can have I think it's 0.1% of gluten, and that's considered gluten free. Well, unfortunately, if you're ever talking to a real functional medicine doctors are going to talk about poop because that is one of the diagnostic criteria. You have to see how people are digesting. If people aren't going to the restroom at least once a day, then they have a problem. If they're going to the restroom 7 times a day, they have a problem. So I can't get away from that one. So when we're talking about, hey, she made it back from delivering the birthday gifts. So anyway, so I've talked about the IgGs. I did talk a little bit about gluten. Natalie, if you have questions about gluten, feel free to email me more, or you can even give me a call, and we would be happy to talk to you about gluten.
Go ahead, sit there. I'm fine.
I'll switch over here. So, next thing we'll talk about. Oh, and there's actually a really good video on YouTube that shows, actually, it's on our page. You can go to the Integrated Health of Indiana page and you can look in the videos, and there will be one explaining leaky gut and going through that quite well. I agree. Can I see your degrees? Yeah, go to our webpage. All of my degrees are there. DC, IFMCP, CFMP, LAC. They're all listed out for you on our webpage. Now, ooh, you're just in time because we're talking about one cause, many symptoms, one symptom, many causes. And as we're talking about that, I've covered foods, I've covered gluten, but now we're to hormones. And so, how does looking at someone's hormones relate to joint health? How does it relate to cellular health?
So a lot of times when you're low on your hormones, specifically testosterone, you will get achy joints, you will hurt in your feet, you'll wake up and you have to warm up. Hormones just affect a lot of things, but for men and women, testosterone is super important. That's what causes achy joints, one of the reasons.
And then you can have issues with food allergies or sensitivities that cause inflammation. Gluten sensitivities can cause inflammation because it will raise inflammatory markers, interleukin 6, interleukin 9, all of those.
Well, and inflammation raises insulin, creates insulin resistance, causes you to gain weight, which causes more inflammation, and then you get caught in the vicious cycle.
The doom loop. And so this is why somebody who does functional medicine also has to look at all these different things. So if a functional medicine doctor is doing one test, then the problem with the one test is you're not looking at, is there a hormonal component? Is there a food component? Is it a microbiome issue? What is it? Where does it come from? And then last but not least, when we look at abundance or we look at deficiencies, especially in vitamins, you have to start to look at stress vitamins. And what is one of the best things to look at for the stress?
B12,
B12.
the B's, just the B's in general, but B12 specifically.
And so when you're looking at those things, the gut has to be in good shape. So if your gut's not in good shape, and back to you, Natalie, if you're not having bowel movements once a day and they're not well formed and there are issues there, then you have a problem with either absorbing or getting enough. She is doing that and added vitamin D. Good for you. Do you know what your levels are? So, like the optimal, not medical, you're alive and living and going to survive, but optimal is between 80 and 100.
Well, and the difference between medical and optimal is medical numbers are based off of, well, sick people, and optimal levels are based off of healthy individuals. So if you're getting your labs drawn in a medical doctor and they're telling you they're normal, you need to have them optimized into a functional medicine lab range so that you know that you are actually normal.
And so I think Natalie's having an issue that I am talking about poop. And so how often do we talk about somebody's stool and why is it important?
All day long. Why is it important? So stool is super important because everybody needs to go and eliminate at least once a day, optimally multiple times a day.
Like twice, 3 times tops. Otherwise you start
how much fiber you are. Otherwise you're just going to cause yourself to have loose stool, and you don't want that either. But I mean, we talk about stool all day long. What does it look like? What's it consistency? You know, how often are you going? When you have to be able to eliminate, otherwise, this all like layers on top of each other. You have to be able to make your hormones, but you also have to get it out. Therefore, you need lots of water and lots of fiber, keep your system moving and regular, because you don't want to get your hormones backed up and then they back up into your liver and then they cause all kinds of problems. So specifically estrogens for males and females, you have to be eliminating every day. Ideally, at least once, ideally two, because fiber pulls the extra estrogens out of your body so that it doesn't put you at risk for cancers.
In the elimination process, that binding to the fiber and pulling it out of the body, they say there are 3 phases of detox in the body, and that's talking about the liver. And when we're talking about this, there is not only the liver, but you have to have it pulled into the bowel
And then get
and
it out.
pulled out.
Otherwise, if it sits inside of your bowels, you reabsorb the toxins that you're trying to eliminate. And it's just a cesspool.
Talk to them a moment about not only deficiencies, I should go down here, but also excess, say B12, because we've seen that. Sorry to
I don't know that
ambush
I've-
you,
I don't know that I've ever had anybody with too much B12.
our foot patient.
The neuropathy.
And remember how
But
high
he,
his
but
was?
he was taking specialized you would have to be taking a lot of specialized supplements, high quality absorbable ones, and he was. So an excess and a deficiency, they're both bad. So you need the sweet spot. I talk better with hormones. So too much testosterone and too little testosterone, you'll have the same symptoms. So
They mimic.
they look the same, and then you have to figure out, do I have a high or do I have a low by testing? Because you'll get joint pain if you have too much testosterone. You'll get joint pain if you have too little. You will lose hair if you have too much testosterone. You could lose hair if you don't have enough. Like, it causes sexual dysfunctions at the highs and the lows. So they each look like each other. So that's why it's so important to test.
And so I'll speak to deficiencies and excesses as well. When we are looking at a deficiency of vitamin D, there for a while I was very low in vitamin D. So I started taking 10,000 IUs a day, and I didn't have any issues with taking that until my vitamin D level eclipsed that 100 IUs. Once that eclipsed that, I started to throw kidney stones.
Yeah, you have to be careful with that. One, you have to have a high quality vitamin D that you take daily. The mega dose once a week is not healthy. And 2, in order to utilize vitamin D, you need vitamin K. Vitamin K helps break the vitamin D down and carry it into the cells. Otherwise, you can't utilize it, and it's going to get processed by your kidneys. And if you are a stone thrower, you will make them.
And I did, and it sucks. So let's see, 112 functions, right? I'm not sure what that pertains to. You have to have protein. Yeah, all the macronutrients are important. We are not carbophobes. We're also not just strictly carnivores. We take a very food first approach. And I would imagine that your protein comment goes back to her talking about fiber. You have to have it all.
Oh yeah, the fiber is just, that's how you eliminate your hormones, the excess of hormones. So ideally you have enough cholesterol and fats to make your hormones, and you want to make them every night, use them throughout the day, and then get rid of them.
Yep.
And you start the process every single day.
And then on top of that, fiber, both soluble and insoluble, feeds the microbiome. And the microbiome is what is in the gut that makes all your short chain fatty acid producing aminos and peptides. It is important with making your neurotransmitters. So you really have to have a balance of all of those things, and you got to know what's going on. She was saying 112 functions in the liver, and that's
Oh, yeah.
probably at least.
Yeah, and going back to your point of fiber, please don't run out to the
Oh, psyllium husks. Yeah.
store and buy psyllium husk and add that to your diet. That's insoluble. It has no nutritional value to the bacteria in your gut. It's just a filler. So you need like a high quality fiber. We use like Endofin. It actually feeds the bacteria of your microbiome. So you're getting fiber that helps move things, but it's actually feeding your gut microbiome.
And so, oh, I lost my
And
little.
we usually, if we were going to talk about our diet, we probably, the healthiest diet would be like a Mediterranean diet where you're getting all the colors and your lean proteins and fishes and things like that.
I'm Googling something. And yeah, your liver deals with actually not only detox, it's energy production. And it's kind of like, have you ever seen one of those big soundboards that you have all these moving pieces on? That's the way the liver works. If your body is wearing down, it goes up on production and it pulls back on detox. If and I'm only talking in our realm of health. There is so much more that the liver does. It also does
We're
your
not liver experts.
it does your
liver.
cholesterol. Yeah, it does your cholesterol. There's Dr. Google says there are approximately 500 separate liver functions. So, um, spinach does need to be fresh. We are whole food, fresh foods,
So if you
but you gotta
you
watch the
love spinach,
lectins.
so spinach is so good for you, but for some people, the oxalates in spinach cause a lot of issues. So you want to blanch it. If you're one of those people where you are sensitive to spinach or the oxalates and things like that, the lectins, you want to blanch it and not eat it raw. But you will know if you're one of those people because you'll have a reaction to spinach.
Yeah. And thank you for that. The body is the body, not only the liver, but the body is I don't care what your belief system is. I grew up Catholic. God, a higher power, Mother Nature, whatever you want to, built and developed a super cool machine. I love the body and the body's functions. It is absolutely cool. And contrary to what our medical brethren, some of our medical brethren believe, you give the body what it needs and it will come back. Sometimes it does need some help. And sometimes it needs just nutritional help. Sometimes it does need a little pharmaceutical help.
Depends on how old you are and how long you've
How
been.
bad you wrecked the car.
Yeah, our young people, they will turn themselves around in 30 days. Like they really, the younger people,
They're more resilient.
yeah, they can absolutely turn their body around, not perfectly, but substantially in 30 days with just diet.
Yep.
With just diet.
And so,
Real food, like
yes,
real
absolutely.
clean food. And so when we ask people if they eat well, most people think that is, do I eat enough quantity? And that's not what we mean when we say eat well. When we say eat well, it's not about quantity, it's about colors. Is it free of pesticides? Is it organic? Is it lean? Like, eat real food that is healthy for your body.
And the population that we deal with generally has some genetic susceptibilities. Now we have a lot of people who come in that just say, "Hey, I feel good. I want to feel better. I want to make sure I'm within that optimal zone." And they do very well. But our patients that come into us with big problems typically have genetic components, and we have to address those. And that takes a lot longer. Most of those people did not get into trouble overnight, and they don't get out of trouble overnight. So we do grow it ourselves.
What is it?
She says just grow it yourself, and we do.
We try. We have a greenhouse and we do what we can.
We do try to walk the walk in every aspect. Um
That
we
doesn't mean we don't treat ourselves, but
Yeah.
but when we do treat ourselves, we try to get high quality food outside. But
Yep. We love the little the little farm to table places. You know, that's probably our guiltiest pleasure. We will go search out the little mom and pop shops where right now I'm just thinking about Cozumel, and we don't eat on the main road in Cozumel. We go 2 roads back,
yeah,
and
those are
they're cooking out in the open, and they got these big pots. And the first time you went there, you were like, "Oh my God, this isn't sanitary." But then,
food is delicious, and people that have gluten allergies or sensitivities don't react to that kind of food because it's actual food and they don't process it the way that we do in the States.
Natalie
And
was talking
they
about
won't even import our food. Our
Yeah.
food is toxic. So people that go and like people that go to Europe and they spend 2 weeks and they eat enormous amounts of rich food, come back having lost weight and feeling better.
Natalie and I had that discussion
Yeah.
earlier.
But
So-
I mean, we don't eat out every week or maybe every other week. I mean, we might eat out at least once a month, but we're not going to McDonald's or anything
No.
like that.
I should let you guide me. She does most of the cooking. So
Actually, we love to cook. Um, and we have just learned we make our own almond milk, we make our own nut butters. I really don't have time to invest in the sourdough, and we don't eat a lot of bread, but I'd really like to do that. I don't know why, but I
well, we got to get some European wheat in.
Yeah.
And we talked about that.
I-
She doesn't do well with American wheat either. So
Yeah, and even the sourdoughs that you buy, if you're using processed wheat from America, I mean, you're gonna get some good things in the sourdough from the fermentation, but it's still not the healthiest bread. So,
nope.
and I don't have a lot of time, but I'd really like to have a sourdough starter. We'll see.
So well, I think that is about everything. And I think we covered everything there. Any last thoughts? I basically went over why functional medicine works, because it goes into the body and it starts to work on the whole web, and how one symptom can have several causes and one cause can have multiple symptoms.
Yeah, and I think when I think about all of the patients and all the education that I provided to them, I think it works a lot of times because it teaches you how you work. I think it really puts you in touch with who you are and what makes you tick. So it teaches you about how to eat, but then how does that food affect you? So what's good for me isn't good for him or maybe you. And it can all be real whole food, but it may not work with my genetic makeup. So I don't do well with eggs. I don't do good with
Peas.
dairy. I'm allergic to peas. So those are all good things but they're not good for me. And so I think it really teaches you how to eat, one, and then it teaches you how that food works in your body and then how you can tweak it with the food. So I really think it really connects you to yourself. And then you start investing in yourself. And then the things that you put in your body and what you do with your body matters to you. And then it just trickles outward. So it's really, and I come from the medical world. I'm a nurse. I've worked in the hospitals with the doctors. And the biggest thing that I have learned is how I work and to listen to what my body is trying to say to me. If once you have eliminated the junk out of your life and then you're giving your body all the wonderful things it needs and you listen, your body has all kinds of wonderful things to tell you.
And that's like for us, it's not about us getting you in a system and trapping you there. We don't want to do that.
I always say we're trying to put ourselves out of business.
Yeah.
Because and then if we teach you, and that's all we're really doing is testing, one, and then two, teaching you about good healthy habits, and then you learn about yourself by your diet, and then
And lifestyle.
and then you learn how you feel as you progress.
And then the best thing about this is, and with all the patients that we've actually released from active care, they actually can make the choice to go have a good time, to go party, to go do whatever they want, and then they know how to clean themselves up. This
And
Natalie
I lost
session
my
is
train
from,
of thought. So what I was going to finish
but
with,
you have fabulous food.
yeah, what I was going to finish with is when you come into us as our patient, we don't just get you, because we're going to teach you about you, and then you are going to help your family members. So it doesn't just affect yourself. It kind of affects everybody in the household.
That's how we say we help generations, because we're kind of, to Miss Natalie's point about doing it yourself, we're actually helping people roll the clock back and get away from and actually identify the fast foods that are killing you. They're all killing you. The sodas drive me absolutely nuts. I mean, love the flavor of them and everything else, but she's the educator. I'm the lab guy. When you drink a soda, high fructose corn syrup goes through your body exactly like alcohol. When it goes through the liver, when fructose,
I
whether
thought
it's
she knows
orange
what
juice,
fructose is. I don't think they have it in Russia.
ooh, do they have fructose in Russia?
I think that's only in America.
Oh, lucky you. But when you consume fructose, high fructose corn syrup, so fructose can even be, if you get orange juice and it's all the pulp's been taken out of it and you're just drinking pure juice, you're drinking pure fructose. That goes through your liver exactly like alcohol, comes out the other side as acetaldehyde and causes all kinds of problems, including genetic mutations. The carbonation in a soda hits your gut and starts to give you carbolic acid. You have enough buffering capacity in your bloodstream. So you have enough of the minerals, the phosphorus, the magnesium, the calcium, the potassium. You have enough of that in your bloodstream to buffer out about 8 of the 12 ounces of soda that you drink. Where do you think your body pulls those minerals from? Pulls it from the teeth and the bones. There is nothing redeemable about a soda. I haven't had a soda now in decades, and I see no reason to have a soda. And I cringe when I see people giving. In America, we give soda to infants, and that's just criminal.
Well, and most people don't buy soda and then just drink 3/4 of it a day.
Yeah.
they're slamming back multiple cans a day, and 8 ounces is it a 12-ounce can of soda? So you really can only 2/3 of that can is all you could really drink per day. But that's not the only acid you're getting throughout the day. And so ideally, you would drink no soda. But
We don't,
if,
not
if
in the
you
house.
drink a soda, I would hope that it would be very little as a treat, because there's nothing good about a soda.
Well, on that bummer note, with that being said, we're here for you. We constitute the treating partners of Integrated Health of Indiana. If you're interested in starting to learn about your hormones, we have several different ways to start to enter into the program to start to figure out where you're at. And we almost always start with an elimination diet and the hormones. And then the programs can start to go from just the hormones to the hormones and microbiome testing to the hormones, microbiome testing, organic acids, and DNA, whatever it takes for us to help you figure out A, what's going on in your body, and then starting to reverse it. And actually, hopefully, pretty soon that new batch of testimonials will start coming out. And then you will see that we treat people of all ages. So if you have any questions, Mrs. Indiana Backdoc at gmail.com. I'm Dr. Miller at integratedhealthofindiana.com. And we're here to help you heal from the inside out. You have a great evening. Stay warm, stay safe, and we'll see you next time.